Simulation's real value is in engagement. People learn, adults learn what they want to learn. They learn what they feel is relevant to them. And what simulation does is it gets it relevant.
So simulation can have a number of different impacts. So certainly from an educational point of view and on learning outcomes, it's a huge benefit, especially around some of the blind spots that people have, because you can challenge some of their mental frames, that the way they look at things and the way they make decisions, which is not something we can really do in other ways.
I think you can sit in a classroom and talk to people, but it doesn't really stick. But to get people on their feet in a safe learning environment where they're not afraid of making mistakes is a really nice way to help people to learn what they need to know in the basics and then to help them cope with their mistakes and figure out what they could do better next time.
There are many different ways to learn, right? So some are visual learners, some are kinesthetic, some are auditory learners, some have to read and write. The unique thing with simulation is it hits all of those different areas of learning, so it really becomes this multimodal learning environment.
It allows you to really look at mistakes and allowing people to go down the road of their potentially flawed thought process in a essentially consequence-free environment.
I think one of the big advantages of simulation, and if it's done right, the student gets to immediately apply some of that knowledge that they're getting from the classroom. I know in our program we actually do simulation in the classroom where they are getting immediate application of what they're learning, and students really learn that well.
Having the opportunity to go through an experience really allows people to have that aha moment or the light bulb moment that they can begin to see things differently.
We started doing trauma drills because we were going after level 1 trauma designation at my hospital. We started in May, but we did something unusual. We did what we called a trauma cam. 2 hours, 3 scenarios, 7 people in the room. We did simple, medium, and complex. They came in fairly much chaos, couldn't identify roles in the simple. We debriefed it, broke it down. The middle one, a little tougher, was an infant, and more about the case, but they got their roles. The third one, observable, change. They had taken what they learned, and then they had the behavior.
So when we look at the impact that simulation can have, I think it's really important to look at the impact on several levels. One would be the level of the provider. So how does the provider feel about their confidence and their ability to perform skills, so skills training and confidence level, and then how do they function within a team? So team communication and working together in a high-stress situation.
I would say the most important thing for anybody interested in medical simulation is to realize you're helping students build a mental model. And in healthcare, that's so important for them to have memory of handling a situation and learning from handling the situation. So it's not just them handling it, but then the faculty are able to interact with the student and really build an effective model for them, so when they're under stress, they can pull from that experience and really help patients the best.
So, we look at classroom environments where you're sitting in an 8-hour lecture and you only retain maybe 5% of what's there. The nice thing with simulation is that it encompasses all those different modes of learning, and students take far more away from that.
I get goosebumps thinking about it, and I wished we'd filmed it, but we told them we wouldn't. Observable change of behavior. You can't do that any other way.
What simulation is kind of a play version of a real life situation where someone could have a good outcome or a poor outcome. And we let them have that simulation in a safe environment so they can be free to make mistakes and learn from them.
What we try to do, and what I think works very, very much, very, very well, is as an engagement tool. And once you've engaged the student, once you've got an engaged, teachable student, you can teach them anything.